Hello, everyone. My name is Adam Ritzak, and welcome to today's webinar, Tips and Strategies for Hosting a Successful Magnet Site Visit, where I will serve as today's moderator. For those who may be unfamiliar with HealthLinx solutions, we deliver nursing and service line transformation and sustainable results for hospitals desiring elite performance in key areas like RN engagement, patient satisfaction, quality, and meeting and exceeding benchmarks for high performance in a service line. Before we get started, I'd like to run through a few logistics today. First, this event is being recorded, and we will send you a link to the recording shortly after the webinar concludes. We encourage you to participate with polls and submitting questions and comments throughout today's presentation. You can use the question panel in your GoToWebinar player to share at any time during the webinar. Finally, you can go to the handout section to find the PDF file of today's slides available for download. And with that all said, I would like to introduce our featured speaker for today. Gina Boring has over 30 years of nursing experience that includes emergency nursing and magnet project director roles. She has consulted on successful initial and redesignation magnet applications, including one that received an international award. Gina is a nationally recognized expert and lecturer on magnet and has authored several papers on magnet designation. And now, here is Gina to begin today's presentation.
Good afternoon, everyone, and thanks for joining us today. It's my pleasure to present to you some tips and strategies for hosting a successful magnet site visit. At the conclusion of the webinar today, you should be able to identify some potential pride stories to share at your appraiser site visit, and also be able to identify some topics of conversation that appraisers often focus on during their time with you. Before we go much further, I would like to host a poll. Tell me a little bit more about you. Let me know, are you a CNO? Are you a magnet project director? Or do you hold another nursing role? We'll wait a few minutes here, a few seconds here, and have you answer those for me. All right. So 5% of those are CNOs. 48% MPDs. Welcome to you, MPDs. Another 40% nursing. Okay, so about half and half MPDs and other nurses, and then CNOs. Welcome, everybody. I know for each one of you, this laundry list of to-dos to get ready for a site visit can be overwhelming. But today we're going to hopefully dispel some of that and shake off some of the nerves and give you some tips for how you can get ready and do it in a smart, organized way. And I think the easiest way to begin this thing is to start talking about a mock site visit, because that's really what's going to bring together all of that preparation that's going to lead you into a successful site visit. So hosting a mock site visit, it's a great way to engage and to gauge the level of awareness of your staff. And I mean interdisciplinary, ancillary staff, nursing staff from the bedside through leadership. Engaging your workforce through a mock site visit is going to allow you some time to remind everyone of what magnet is. You know, not everybody, nursing may be aware of what it is, but do your interdisciplinary and ancillary staff, do they really get what it is and why those appraisers are coming? So that mock site visit is a time of not just practicing, but teaching, so that they can learn too what it is and why the appraisers are coming. And then it's going to allow you some time to connect those dots from your document to the site visit, and then to practice what that site interview process might look like. It's a good time just to shake off the nerves. But most importantly, this is a time to not make this a pop quiz. You know, it's a time to prepare and to take in the tips of others and maybe your own past experience if you're redesignating. What did you learn from your last experience, and what can you learn from site visits of others? Because over the years, if you're doing it every 4 years, site visits tend to change a little bit because the manuals change, so there may be some minor nuances. So make sure you're still benchmarking and checking with other organizations and networking and finding out how their site visits went. It's a great time to prepare for your appraiser guests. So there are some things that you're going to want to do in addition to that mock site visit to prepare for your appraiser visit. I would suggest to you that you read that document. If you weren't a part of writing it, if you weren't a part of putting it all together and you're not really sure what's in there, Get really comfortable with that document. If it has a search function, many of those electronic documents do have a search function. Plug in your name, see if you're in there. You know, type in your name of your department or the name of a project or the title of a service line, and see if they've told a story about you that you might have been involved in or you might be familiar with. You should be at least as well informed as your appraisers. And believe me, your appraisers understand and remember every corner of that document. So be familiar with it. Would suggest that you practice not hiding from appraisers. Now, your nurse leaders aren't going to hide, but a lot of times you're going to get direct care staff that are a little intimidated. You know, they're used to those joint commission visits that feel a little more threatening. And, full disclosure for you, when I was a direct care nurse, I may have spent some time hiding in the bathroom when I saw a joint commission appraiser coming down the hall. But this is not the time to hide. It's the time to have your voice heard. To come prepared, to have an exciting story to tell. We're going to talk a lot today about pride stories. It's just time to engage your staff and get them comfortable with some of the potential questions. And then this last bullet point, I'm just for those 5% of CNOs that are here and the other nurse leaders that we have, you're looked at more as an adornment, and I say that with all the love in my heart, but those appraisers are coming to talk to those direct care nurses. So the board of directors, the executive leadership team, your nurse directors, managers, on the first day, the agendas for those site visits always look about the same. That's been our experience, and we've done that close to 150 times. So I think it's a pretty good number that we can gauge that that's how it goes. They're going to meet with those executive and senior leaders for the first few hours of the very first day, and then they're going to kindly ask you all to step aside, and they're going to go right to the bedside and start talking to those direct care providers. All right, so what to do once they hit the bedside? When those appraisers start going on these unit site visits, I would say the nicest thing that will dispel some of that, the jitters, is to practice walking through your unit with your nurses. Like, start at the point of entry where those appraisers are going to meet you for the very first time. So whatever that point of entry looks like on your unit. So gather there with your nurses and walk through your unit. What makes sense and what are you passing along the way? Are there quality boards? Are there celebration boards? I often see plaques with the names of certified nurses. Is it up to date? How many certified nurses do you have? Is that a display somewhere that it's a talking point for you as you walk through the unit? Did anybody on your unit present a poster at a national or local conference? Is that on the wall? Remember to use those as visual cues, and they're great. They're great topics of discussion. They're great places to stop and just chat. It really looks serendipitous, almost like unplanned. I mean, you don't want it to be a production. This is not a Broadway production. This is, it should look natural and it should be just topics of conversation. I have seen some nurses meet appraisers and come just straight up and say, so what do you want to see? Where do you want to go? What can I show you? And then I've seen other nurses welcome their appraisers, and they take command of the visit. They take control of the stroll. So do what feels comfortable to you. And there is a certain level of command that you're going to want to attempt when you're escorting the appraisers around your unit. It does show pride. I think it shows pride. I've not had any negative comments come back when we've directed folks to have a site visit like this on your unit. Like, your nurses should be prepared. They're excited. They know they're coming. But know also that every appraiser is different. So while some appraisers may gladly allow you to take the lead and stroll them through your unit and tell your story, you may find other appraisers on that very team that just sort of stop you and tell you where they want to go. So be agile and just be prepared for just about anything. But always see if you could take advantage of directing that walk through your unit. So hopefully, if you're joining me here today, you have some familiarity with Magnet and why you're pursuing Magnet status and why you may be having this site visit. Just a few. Gosh, these are just a few of the documented benefits for Magnet. Those improve patient outcomes, doing what's right for the patient, improving those outcomes, decreasing morbidity, mortality rates, improving patient satisfaction. For nursing staff, to have that engaged nursing workforce that provide autonomous, empowered nursing care. I mean, what nurse leader doesn't want to say, our nurses are practicing autonomously and they're empowered, and you would want that for your nursing staff. So it's truly a benefit of designation. And it's what your appraisers are going to be looking for when they come on site. Then, of course, just a couple. These are just, wow, the lowest hanging fruit. Benefit to the organization is decreasing your turnover and decreasing those open nursing positions. I'm going to show my age on this next slide. But for those of you that have been with Magnet for a little while, years ago, like around 2000 to 2004, maybe 5, we wrote documents to the 14 forces of magnetism. But those 14 forces of magnetism are still alive and well. And when those appraisers are on your unit, they're looking to see if those 14 forces of magnetism are truly enculturated across the breadth and depth of the organization. The very first force of magnetism is the quality of nursing leadership. So for those CNOs and nurse leaders on this call, I ask you, would your nursing staff describe you as a knowledgeable risk taker? Would the clinical nurses in your organization tell the appraisers that their nurse leaders are advocates for their practice and supportive of nursing staff? And could they give specific examples of that? So these are the comments that provide the appraisers with a strong sense of enculturated support for nursing practice. Think about examples that you might be able to share as a nurse leader that would convey this level of strength. So remember, you're trying to get your appraiser to understand, what does the quality of nursing leadership look like in this organization? And I already told you, as a nurse leader, you're only going to really have a very limited amount of face time as opposed to how much time they're going to have at the bedside. So tell those stories that convey this level of strength. And if you're a clinical nurse and you're joining this webinar today, try to think about some examples where your nurse manager or your director or your CNO advocated for you and share that story. All right, so are we going to, I think it's time for another poll. We're going to do another poll. All right, I want to know a little bit more about you. So tell me, for those of you that are joining the call today, I want to know, have you submitted documents and you're waiting on a site visit? Are you currently writing and preparing for an upcoming site visit, or are you just here learning more about the Magnet site visit prep? Tell me where you're at in that process. All right. Okay. So about a third of you have submitted documents and you're waiting for that site visit. A little more than half of you are writing. All right. I know how busy you are. So to those of you who are still writing, thank you for taking an hour out of your day to join us. I know an hour is a lot of time when you're writing a document. And then about 10% of you are just learning more. So good for you for joining us today. It's great to have you here. So during that site visit, during your actual site visit, remind staff that appraisers are present and that they may be randomly called to a breakfast or lunch. Appraisers are usually you're going to have 3 or 4 appraisers or more. Usually they're on site for 3 or 4 days, depending on how big your organization is. So there's a lot of face time opportunity for a breakfast or lunch, and staff are going to be invited to breakfast or lunches with 3 or 4 appraisers, so they have a good time to get a good sampling. So just let your staff know you might get called to join us for breakfast or lunch. Let your ancillary staff know. You know, that interdisciplinary group, housekeeping, pharmacy, all of that, physicians, let them know that you have guests that are coming, and then inform your patients and staff. There's going to be an agenda for every day. For those of you that have had a Magnet site visit, you know that the CNO and MPD work very closely with that lead appraiser, and together you create a site visit agenda. There are a lot of things that look the same in those site visit agendas. But what we do know is that there are appraiser escorts that are assigned to each appraiser, and the appraisers expect those escorts to keep them on time and on task. So If you're assigned, let's say you're assigned at 11 a.m., they're supposed to be on your unit at 11 a.m., you can plan on them being on your unit at 11 a.m. They usually like to be on time, and so you have the opportunity to be ready and to prepare. I would say every day that those appraisers are on site, you're going to want to huddle at least once in the morning, at least once before every shift, and possibly a few times throughout the day. Pull in any of those ducks that are on your unit. They might be rounding. It's kind of nice to have a physician pop their head in when the appraiser's on the unit, give nursing a shout out. Pharmacist, dietary, housekeeping, really the same for all of them. And encourage them to jump in if they have a story to tell. Don't leave anybody out, all right? This is everybody's journey, so we don't want to leave anybody out. Look over your patient roster. This is another great tip. I would say that you're going to want to pick out a few really good candidates for your appraisers to speak with. And occasionally an appraiser may speak with a patient of your choosing. So you're going to want to choose wisely, like who are the patients and who would be a good candidate for your appraisers to speak with. And hang on just a second. I just lost my PowerPoint. Let me log back on. Technical difficulties. All right, there we go. So for an hour or two before your appraisers are on your unit, I would encourage you as a nurse leader and rally up your nurses around you to go to every patient room, go into the lounges, where your family lounges, and let your visitors even know that you have guests coming from the ANCC. Tell them why they're there. Appraisers like to go into lounges and ask families about the nursing care of their loved ones. And there are certain lounges that tend to have more of an appeal to appraisers than others, and those are like your lounges for where patients tend to reoccur, like dialysis or infusion. They're popular watering holes for appraisers to stop by and ask about the care. So prepare everyone and let them know that you have visitors for the day. Responding to appraiser questions. So when an appraiser, if you're in a session with an appraiser, or if they're on your unit, if the appraiser is going to throw out questions, oftentimes they'll throw out broad questions like, tell me about something that you fixed. Tell me about something that's going right here. Give me an example of something that challenges you every day. Like when you go to answer, introduce yourself. Hi, my name's Gina. I am a direct care nurse in the ER, and then give your answer. So tell them your name, tell them where you work, tell them your role. Answer the first inquiry that you're comfortable with, and speak with confidence and pride. And then, of course, professional courtesy. So rotate responses, turn off those pagers, turn off your cell phones. Be careful if you're the quiet wallflower. So we talked about those folks that might be a little bit intimidated or kind of quiet on the appraiser end. The appraiser may notice if you're the only one not talking, and they may ask you something very specifically, and you may wish you had jumped in on maybe one of those first 2 or 3 questions. So, answer the first question that you're comfortable with. And if you do feel like you're getting put on the spot or you're being asked something that you're not really very comfortable with, it's okay. You can say, gosh, I hate to tell this whole story because it was really Amy that drove that initiative in our unit council, and maybe Amy will save you. Or if you're in a group and they're asking a specific nurse a question and you could tell that nurse is stuck, jump in there and save them, like help them out. It's okay to just gently nudge the appraiser into an answer, like help with the answer so that nobody really feels like they're put on the spot. Great appraisers aren't going to allow your nurses to feel that way. So we put a lot of pressure on ourselves because, those nurses that are showing up to these site visits, they want to be successful. They want to tell the best story. So nerves kind of get in the way. Just make sure that you're answering questions when you're comfortable. Don't answer every question either. If you're that one that knows all, you're the council chair and you're involved in all this stuff and everything the appraiser asks, you jump in and answer. Appraisers grow weary of the same person answering. So find some middle ground and just enjoy the visit, but just jump in if you see somebody struggling with an answer. I mentioned earlier that laundry list of things to do. How do we get ready for the site visit? What should I do? What do I need? Like, what's that list look like? And this is the beginning of that list if you don't have one already. Organize your meeting minutes. And I mean, nurse managers, your unit meeting minutes, if you keep minutes from huddles, your unit councils, those minutes from unit councils and org level councils, make sure that they're organized and they're accessible and that they're complete. Employee files. If an RN is required for the job description, you must have performance appraisal, peer review, and goals for every one of those folks. Anecdotal notes if they're in there. Make sure those files are complete because the appraisers are going to pull a good number and a variety of RN files of performance appraisals. And they will continue to pull and evaluate those files until they're satisfied that those appraisals, peer review, and goals are completed across the breadth and depth of that organization. So do that now. It's never too early. Even if you're writing, you could have somebody on that and start going through the list. Every nurse, every file, make sure they're in order, that they're orderly and accessible. All right. Focus your huddles to include any updates. So you might do that now, even though you're writing documents, occasionally update. If you know that a story is going into the document that came from that unit, add that in there. Preparing for this magnet site visit shouldn't be something that you do in the 2 or 6 weeks or however long between document submission and finding out you're going to site visit. It should be a part of your culture, something that you do. Let them be a part of the journey. So keep your nurses, keep your staff updated on progress, on what's going on. Review your documents. We already talked about this. Search those documents. Know if your name is in there. Know if there's a story told about you. Nurses specifically should be familiar with where that document is, how they have access to it. That document gets put up for public comment within the organization. So there'll be signs at the points of entry and at the elevators, and those documents need to be accessible to nurses. So when your appraisers come on site and they start asking your nurses, did you read the document? Are you familiar with the document? They can very easily say, I didn't read it, but I know it's available on our intranet and I can access it from my desktop on any computer. Like, they should know where it is and how to get to it. But there's no quiz there for, did you actually read it? They just need to know how to get to it. And then, of course, like we said, it's not a joint commission visit, but you should be presenting a neat and clean unit. Just the tip of the iceberg for what to do. All right. When your appraisers are on your unit managers, you get to take a coffee break. They really don't want to see the whites of your eyes. So when you know that appraiser's coming, they want to talk to the direct care nurses. They want to talk to your staff. They don't want unit managers peering around the corner or peeking out the window of your office. Just take a step off the unit, take a walk, get a cup of coffee, and then come back once you know that they're off the unit. But you really shouldn't be hanging around. Be there for the mock site visit, though. You might not be there for the regular site visit, but for your mock site visit, I would say be there. You should be hearing what your nurses can speak to. What's easy for them to talk to? What catches them? What trips them up? Like, what do you need? What do you need to get together to get them ready? I mean, what's easy for them to speak to, and what are they struggling with? So make sure you're there for that mock site visit. Staff, get them used to approaching the appraisers. Takes a little bit of practice. Hi, oh my gosh, we're so excited to have you guys on the unit. We're so excited to have you here. We've been waiting, looking forward to this. Make sure they show some enthusiasm and that they're waiting for them. And while those appraisers are on your unit, make sure that somebody has been assigned to call lights and issues of care, and that they're addressed promptly. It frees up your nurses to not have to be coming and going if that's somebody's responsibility while they're in the unit. All right. Of almost everything that I have to say today, I hope that you all walk away having an understanding of what it means to have a pride story And if you're a nurse, I'd like to know that you have 2 or 3 pride stories. I just simply cannot beat this drum loud enough. And anytime I'm getting an organization ready for site visit, it's something that I beat on every unit, on every gathering um, of councils. Like, you have to have a pride story, because you're going to be called on. That interaction with appraisers, there's so much opportunity for nurses to be interacting with those appraisers between the unit tours, the lunch invitations, impromptu in the hallway. Every person, and I mean every person, should have at least one example of something that they're proud of and that they want to share. Even, I don't care if you're a pharmacist or a housekeeper, it doesn't matter who you are. If you get stopped by an appraiser, there should be something great that they say, this is that one thing that I would want to be able to share with you, and I'm so happy to have the opportunity to say this to you. Whatever it is, have that pride story, because there's nothing worse than crickets. This is how it goes. The appraisers come to your unit, you're really excited, or you're nervous, or you end up totally tongue-tied, and the second that appraiser's down the hallway and they're pushing that button on the elevator, you have that head-slapping V8 moment, like, oh my gosh, I can't believe I forgot to say this one thing, the coolest thing we've done, and nobody said it. So practice. What's that one thing that your appraisers need to hear about your unit, or your nurses, or your nurse leaders before they walk off your unit? Try to think of ways that you can make your unit visit memorable. As I go through these favorite topics of conversation by appraisers, I want you to continue to think about ways that you can create conversation around these topics. I want you to share them with your nurses, with your nurse leaders, come up with some examples. It's okay to use some of the examples in your document, but honestly, they're kind of old by the time you get on site visit. So come up with some new examples, and it shows some variety for the appraisers too. So they're hearing new stuff from you. They already know what you wrote. Like, come up with some new exciting things to share with them while they're on site. You know they're going to talk about quality. You just know this is going to be a topic of conversation on every unit, most likely. So the appraisers aren't going to be expecting for your nurses to regurgitate their data per 1,000 patient days, but your nurses should be able to know if they're above threshold, or if they're addressing a quality issue. How are they addressing it? Is it a standing agenda item on unit or organizational councils? What are they doing to address the data? Is it working? How do they know it's working? What are the initiatives? What are the impact on outcomes? It's okay to discuss underperformance. That's okay. I mean, that's kind of what Magnet's all about, right? It's not about being perfect. It's that you're tracking your data and you're identifying opportunities, and that you're addressing them and improving them. So it's okay to be passionate and talk about your data, even if you're underperforming. If they want to know that you're taking full advantage of addressing any of those opportunities that might be rearing their ugly heads on those red lines. When you show an appraiser your quality boards and you want to talk about the green stuff, like you want to talk about the good stuff, and they probably will allow you to talk about the good stuff, but if you think you're going to skate through the bad stuff, you're probably not. So have a conversation about it. Pull your nurses up around those quality boards and say, how are you going to talk about this? What do we have to say about that? We have an issue on this unit with falls with injury. What are we doing about it? Make sure they can articulate it. Make sure that they can tell their stories around it. Show off the good stuff, but be prepared to talk about the underperformance. Patient SAT and RN SAT. Now, one or both of these topics are going to come up on every unit tour. Just be prepared to speak to it. You should have bulletin boards that have your data on it. They're going to want, again, to know, do your nurses understand what's better or what's worse since that last RN satisfaction survey? Why is it better? Why is it worse? What are they working on? What are they doing to address their data? Same with patient SAT. What are you doing about it? What challenges you? Maybe your patient population makes something a struggle for you that might not be a struggle for somebody else. So it's just addressing it to your clients. It's just addressing it to the data and making sure that your nurses are able to talk to it comfortably. Where is your data posted? I'm sorry. Oh, we can talk about it here. That's okay. Like, I want you to also talk about where is your data posted. When you start identifying quality discussions and your nurses start talking about it, what's really cool to hear when I'm in an organization working on a mock site visit, some nurses do it naturally, and some of them you have to pull the information from them. They have the answers, but it's so much nicer in front of an appraiser to have a nurse say, well, we've been addressing this falls with injury issue. It's really been something that's challenged us for the last couple of years. So we took it to our unit council. We pulled the data. We went to our medical librarian. We had some literature. We tried something different that we hadn't done before. We're watching our data. We've had some, like, if they can tell the whole story, that's the best kind of story. So practice it. When that kind of cadence is woven into the DNA of what you do, it's going to come out in the conversation. So it presents a really strong way for your nurses to present their quality data if they can just tell the story and just pull that string. Professional development. This is another thing that a lot of pride stories come from this slide right here. So what do the educational opportunities look like in your organization? Do you have contact hours offered in-house? Do you have formal programs for BSN, MSN, PhD? How are they facilitated? How are they reimbursed? How are they encouraged? Same for certification. That's probably somebody's pride story. How were they supported to be nationally certified? What took them to finally sit down to be board certified? It's a pride story. How are they supported to do that? And then that, who's written 005? I almost feel like I can hear head slaps. It's a hard one. 005 is tough. That educational needs assessment and then the related implementation plans. But if you have a brave nurse out there that's willing to talk about this, I promise it'll pique the interest of your appraisers. So how have their educational needs been assessed and addressed, and what difference did it make? That would be pretty cool to have some nurses with those as pride stories to share. And they want to hear those levels of that kind of story from all levels in the organization, from the bedside to the CNO. Not forgetting advanced practice, not forgetting ambulatory. It's everywhere. Everywhere nursing is practiced. All right. Shared governance, shared decision making. Your appraisers are going to meet with your councils. They may meet with unit chairs. They are going to definitely, I'll say definitely, I don't think I've ever seen an agenda for a site visit where the appraisers haven't asked to speak with your practice council representatives or quality council or research council. Whatever your councils are, they will most likely meet with representatives from those councils. So, what are you doing? What are the initiatives? What have you been successful at changing? What kind of support do you have? How do you integrate evidence-based practice and professional standards into those projects? And then communication. This is when I want you to be very careful in discussing out loud. We've watched this trip up organizations in the past, and we've heard stories about it. Don't let it be you. Unit council to org council. A lot of organizations will have the chair of their unit council be the unit representative on an org council, but they want to know, how is information fed from the unit level to those org councils, and how does the information come back from those org councils back to your unit councils and direct care nurses? How do direct care nurses, how are they communicated to? How do they know what's going on? And then, how do the nurse leaders and the CNO, how are they kept in the loop for what's happening in those councils? Usually there's an executive council where everybody reports up to those nurse leaders and CNO, but make sure you can articulate it and speak to it. That's really a very important topic of conversation that you want to make sure that you practice and you have very clear, strong answers for, because I'd be surprised if that doesn't come up. Here's another topic. Here's just another tip. Don't wait for the appraiser to ask you the question. It's okay to answer it with a really great answer. Like if they want to hear about communication. They want to hear about the integration of evidence-based practice. They want to hear about support and advocacy by nurse leaders. Anytime you can weave those kind of details into a story, weave it into the story so that the appraiser doesn't feel like they're pulling the information out of you. So tell the story, talk about your project, talk about integration of best practice, evidence-based practice, going to the literature. What are you tracking? Is the data nationally benchmarked to the NDNQI? Like, tell that whole story, because I can just see little, like if there was a little checkbox in an appraiser's head, I can see it going check, 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 check. You just talked about evidence-based practice. You talked about support. You talked about tracking the data. Like, everything in that story makes sense. You have to practice to get that kind of detail into a story. That's a pride story. Make sure you include all the details that you can. Okay. Access to resources. Who are they? Who are your experts? And I mean like skin team infection prevention, APNs, rapid response teams. How are they accessible to your direct care nurses? Electronic resources, your policies, access to best practice, medication references. Nurses don't need to just say, yeah, we have access to it. It's on the intranet. It's on, our computer on wheels, and they want to know, have your nurses prepare a story. I have an example of that. I had one night, it was 10 o'clock at night, and I had a patient that just got put on a new med, and they were asking about it. I was able to, pull that up electronically, print it off for them, and it just really, they were able to sleep that night. It was just really important to have that kind of access to resources at my fingertips, at the bedside. Like, anytime you can tell a story, instead of just saying, yeah, it's there, we have access to it. If you could tell how you used it, how you actually went to it and used it at the bedside, that's so much of a stronger story. Don't wait for the appraiser to ask you how. That's another example of how you can weave that into an answer. So access to resources. What about leadership? How do your nurses have access to leadership on the off shift or on weekends or holidays? And then ethics consult. Every nurse should know how to call an ethics consult. What happens at 2 in the morning on the 4th of July when they have an ethics consult? Who do they call? What do they do? What does that look like? And if anybody has had to convene the ethics committee or convene an ethics consult, they can tell their story and explain how that went. Not just knowing how to do it, it's giving an example of when it actually occurred. And so you might have some folks that say, I don't really know if I have a pride story. I can't really think of anything. Well, go to relationships, because I'll bet you when you go through this list, you're going to come up with an example. Those relationships, nurse-to-nurse interaction, nurse-to-physician, nurse-to-ancillary staff, staff nurse to manager, staff nurse to CNO. Is there anything that triggers an idea for a pride story? And tell it. Not every story needs to be this great big diatribe. It can be a simple thing like a staff nurse saying, you know what I really appreciate? I really appreciate seeing my chief nurse go on rounds through the unit, and she just stops and asks me how my day is going. That to me makes me feel like she cares about me. She cares about my work. And that's all she needs to say. It doesn't have to be a great big story, but something simple that allows that appraiser to understand what the culture in the organization looks like. Some other topics. Staffing. Oh, they're going to talk about staffing. Do you self-schedule? Do nurses have the ability to put in requests? How is their unit staffed? What's the RN mix? Are you a 4-to-1, a 2-to-1? And how do you know if your staffing is effective? And how is staffing reflected in the care delivery model on the unit? So first, your nurses need to know what the care delivery model on the unit is. Hope that they do. They should know what their professional practice model for the organization is and tell their story around that professional practice model. But for care delivery model, You know, do they practice team nursing like in the ER or OR? Are they couplet care as in mother baby? How are you staffed to meet that care delivery model, and how do you know that it's effective? Other topics. Floating. I know it's called a billion things now, but just bear with me. 30 years ago, we called it floating. When you're pulled from your unit, are you pulled within your level of competency? And how do you know you're pulled within your level of competency? They may ask you, have you ever been pulled from this unit to work on another unit? Where did they send you? How did they know you were the right person to send to that unit? Did you feel comfortable going there? Those are some things that you're going to want to make sure you're talking with your staff about, and that they understand, and that you understand what they're going to say, and that they understand what being pulled or floating to other units looks like. Overtime, is it mandatory? Gosh, I hope not. Do you have on-call? Do you have the ability to sign up for extra time? What does overtime look like in your organization? And then some examples of advocacy, autonomy, community partnership. Those community partnerships are great stories. So there's just such a wide variety of topics that you can come up with for how to come up with pride stories, how your discussions should look when your appraisers are on the unit. I feel like I've overwhelmed you. I've gone really fast through a lot of these topics, but there's so much that you could talk about. I just want to make sure that you understand it takes practice. It takes a lot of practice. It takes really strong nurse leaders that will go in there and say, we're going to site visit. Let's get our plan together. Not one mock site visit. Maybe you have lots of little mock site visits. So don't be afraid of that. Practice is everything. This is not a pop quiz. So when people are comfortable, they're going to talk. They'll share. So just to wrap this thing up, just have a little bit of fun along the way, would you? Like, enjoy the ride. You know, play games, do your thing. I've seen some really fun stuff out there that people do. They, you know, from Wheel of Fortune stuff to, you don't have to do that stuff, but, you know, at least have some fun with it. Back when I was a magnet project director, I'd just put those little mini candies in my pocket, you know, like little Hershey bars or Milky Ways. It's amazing how people will stop for a candy bar, you know. Give me a question, Gina. Give me a question. You got chocolate in your pocket. I know you do. Like, just do something that's fun. This is their time to shine. It's their time to be proud. You know, get your staff invigorated. When you're prepared, you have the luxury to enjoy and get excited. So for those of you that are waiting, we had like 30% of you that were waiting for site visit, and another 50% of you that are, so 80% of you are like on your way to a site visit. Congratulations to you for at least embarking on the journey. So I think we have all I really had, but I wanted to ask you, Adam, do you want to ask her, like, does anybody have any questions they want to toss out to me?
Yeah, thanks, Gina. Yep, we have some time available here to go through a few questions. One question that's come up a couple times I just wanted to address real quick. We've had a few people asking about if the recording of this webinar will be available after the presentation. The answer to that is yes, it will be. Number one, all of the attendees today, there should be a handout section you can see on your GoToWebinar panel, and you can actually right there click on that and download the PDF version of the presentation slides for one way. Additionally, shortly after the webinar concludes today, we will be emailing everybody a link to come download both the video and then also be able to download those PDF slides again. And also, as another note, just so everyone's aware, any and all webinars that we host here at HealthLinx, we post these all to our website. There's actually a webinar-specific page on our site that you can access and drill through and look at all the ones we've had and obtain both the video and PDF slides there as well. So several different ways, but between the handout section for the PDF file, between an email follow-up we'll send you, and then also on our website, there's a few different ways to access both today's webinar and previous ones as well. All right, questions for you, Gina, that I can get through here. A few that we've had, and again, I encourage any attendees on with us now that if you have questions, go to the questions panel in your GoToWebinar player and send those in. The first question that we have is, how much can you really direct an appraiser when they're visiting your unit? Will they just let you lead them around and tell your story?
Yeah, we talked about that a little bit, but it depends on your appraiser. I know that's not what you wanted to hear. I would say show up with a plan. Make sure you practice, walk around your unit, know where those visual cues are for discussion. Make every attempt that you can to lead them to places that you want to show off. It is your unit. They're there to visit you. So make every attempt to lead that, but just be open to that the appraiser may have their own idea of what they'd like to know from you. So you're not going to bully an appraiser into just leading the whole thing by yourself. Like they're going to probably direct it a little bit, but I would say gently nudge them in the direction you'd like them to go and tell your story and make sure you get an opportunity to show them the pride that you have. So I hope that answered. I hope that helped.
All right, great. The next question we have comes from a manager asking, do I really have to leave my unit when the appraisers are interviewing my nurses? And if so, why?
Yes, you really do. You really do need to. You really do. They just want one-on-one time with your nurses. So, it doesn't mean that you're intimidating or that you're going to be there and lead the witness. I think they just want to hear from the direct care nurses. And, in a good way too, if you think about it, because if your direct care nurses want to talk about, I've got this great manager, they may be more reluctant to say either way. It'll look like they're kissing up. You know what I mean? Like, just go, get a cup of coffee. It's just their time. You'll have your time with the appraiser. Your nurses need to have their time. So yeah, they really do want you to go. Or go to your office, close the door, and, call your mom. Just step off.
All right, the next question we have is, how long do we have to wait after the site visit to find out if we've been designated?
Wow, that's a $1 million question. So I want to say that we had one organization that knew within a month. It was shocking, and I think that just happened to go to the commission. They got the report done and got it into the commission really fast. Generally, it's about 3 months, and then they find out, 2 months on the earliest, usually about 3 months. That's safe. If you have a question about it, if you get beyond 3 months, I'd be calling your analyst at the ANCC and just saying, hey guys, we out there? You didn't miss a phone call or anything, did you? So you're not going to miss that phone call, by the way. And you'll know after you have your appraiser site visit. For those of you that have experienced this, you'll get a phone call, and that phone call, when you're successful, they're going to say, gather around 500 of your friends and we're going to give you a call. So when they're inviting you to invite other people to a call, it's a good thing. So if they call just to schedule a call with just your CNO, then don't order the balloons. If it's just the CNO, it's usually not good news. But if it's with everybody, if they call to schedule a call, and if they don't tell you to, you can even say, is it okay if we invite our staff to this call? And they'll say, yes, my goodness, yeah, invite your staff. Then you'll know who to invite.
All right, we've had a few more questions coming in here, so thank you to everybody that continues to submit your questions. The next question that we have is, what advice would you give to an established magnet facility with a new MPD?
Oh, gosh, get that MPD networked with other MPDs. If you're within a system or if there are other magnet hospitals close, make sure that you're networking with other MPDs. Send them to workshops. Get a consultant. How about that? Yeah, you just need to get as many partnerships as you can. Send them off, educate them. There are a lot of things that they can do. Read other people's documents. If you can find somebody that will share their documents so that they can get a good idea of what does the document look like, how do you display the attachments, and And then just that knee-to-knee time with an MPD with another experienced MPD. There's still like a consortium out there for MPDs, isn't there, through the ANCC? I would say network. Go to those to that MPD meeting at the Magnet conference and make friends, like make connections.
Our next question explains that many of the direct care nurses carry mobile devices on which they receive telemetry alerts, pages for stat orders, etc. Is the best approach to hand those off to another caregiver while you're with appraisers, or simply notify the appraisers that you carry this device on which you receive important notifications of changes in patient status?
So I would say hand that off anytime that you can. So if you're called to a lunch with the appraiser, hand it off so that you're not up and down. I mean, the appraiser doesn't want popcorn in the room. They're up, they're down, they're in, they're out. You know what I mean? Like hand it off before you go. If it's on the unit, if it's a unit visit and you have, 8 nurses on the unit, and 7 of the 8 can be there, you can't all hand off to one poor nurse on the unit. So, and they understand that issues of care have to be addressed. So I think it depends. But if you get called into a meeting or if you get called into a meal, then I would say hand that stuff off, give that to somebody else. You're going to want to staff up too, managers, for those 3 or 4 days when you know you're going to be having a site visit. Site visits are very expensive for a lot of reasons. But one of the biggest reasons they're expensive is because you got to staff up. I mean, you're going to need a couple extra nurses on every unit. That adds up really fast. But it's the only way you're going to be able to hand off and get the nurses FaceTime with the appraisers and still have your patients taken care of.
All right, the next question here, I'm sure many people have wondered, is what have you seen from the visit that can lead to an organization not being designated?
Yeah. So if something is not enculturated, and by that I mean if you in your document tell this beautiful story about how you have unit councils and they meet every month and those councils are integrated with the system level council or an organization council, and like you tell this whole story, and then your appraisers come on site and they start talking to nurses about unit council. Well, how often do you have it? Well, I don't know, I mean, we try to have it every month, but yeah, well, when was your last one? I don't know. Maybe it was like 3 months ago. When they start sensing that, like, this isn't real, like, if you're not really doing what they read in that document, that disconnect between what you said and what they're experiencing on site, that's a really easy way for them to say that this culture is not broadly accepted across the organization. We have heard tale of organizations that, especially if there's a organized workforce, that there can be issues with there can be issues there with them just not wanting Magnet or having a vendetta against it or whatever that is, and they show up at different meetings and just say things that it's just enough for the appraisers to all say, yep, we heard that too. Yep, we heard that too. Yep, we heard that too. I had one organization that, and this is kind of funny, the appraisers asked for a room and they wanted an email sent out to the entire organization, so if anybody wanted to come and privately ask that appraiser or tell that appraiser anything, they could. And so the MPD and the CNO, they crafted this email. It went out to everybody. They had these appraisers sitting in these 2 separate rooms, and nobody came. Nobody came. Nobody showed up. It was a great site visit, but nobody showed up. Nobody had anything to say, I guess. And so what happened was the appraisers went to that MPD and CNO and said, we want to see proof that you told your nurses that we were here. So they did. They showed them proof that they were there. And guess what? They said, tell them that we're going to be here again tomorrow. And you know what happened? The line was around the hall. Because every nurse manager said, send somebody, go say something, go. And then it's like they just couldn't get to a happy spot. You know what I mean? It's like, if you don't send anybody, if you send too many, like, it just depends on what nurses say. I don't know, you guys. It's tough. But I would just say make sure you keep track of your communication. Make sure that you're talking to all of your nurses. If there's a problem or if there's an issue, you look it in the eyes and you talk about it. Because if you don't, if you think that that's not going to come up during a site visit, I promise you it will. And it's okay for sometimes you'll have one or two people that'll say some things and you just want to cringe. But when you have 10 or 12 people in 10 or 12 different sessions saying the same thing, the appraisers start going, wow, there feels like there's a problem here. Feels like there's maybe something that we need to dig a little deeper. This doesn't feel like it's as real as it felt in that document. So that's the kind of disconnect. Sorry, I rambled on and on. It's a tough one to answer.
All right, looks like we have time for maybe another one or two questions. Thank you again to everybody that's been submitting. If we do not have a chance to get to your question during the live event today, we will certainly do our best to follow up with you within the next day or so as well. So appreciate your patience on that. The next question that we have is, can you offer tips for the appraiser's focus in the emergency department?
Oh my gosh, who knows that I was an ER nurse? That's what I did. Yeah, because you can't shut the front door, right? It's not like you have 20 beds and you can't fill it with 30 people. So staff up, make sure your nurses are prepared. I would say there's not a whole lot that you're going to do differently than anywhere else. Get your physicians in there, get them involved. You work closely with those docs, with physician assistants, with advanced practice nurses. Everybody should be a part of that conversation. Talk about all the things you'd talk about on any other unit. I don't know that there's anything particularly different that you would do other than it tends to be one of those areas. The OR is the same thing. It's tough to walk in when you've got a full patient load and now they say, we'd like to talk to 5 of your best and brightest. And you're like, yeah, well, they're all in cases. So it's very difficult. I think the biggest challenge those areas have are pulling people out of rooms and away from things that it's difficult. So that'll probably be your biggest challenge. ERs and ORs, it's not really where you have your shrinking violets. So those nurses are not afraid to speak up and tell their truth. So you won't have a problem with them rising to the occasion. The problem is getting them away from the bedside to do it.
All right, well, that looks like it's going to be it for time here. Again, anybody with these questions that we did not get to today during the live event, we will certainly follow up with you here shortly to address your questions, and appreciate you reaching out. In closing today, I just want to share that if you do have any questions regarding HealthLinx solutions or to inquire about partnering with us, please contact us by phone, email, or by way of our website, as you can see on the screen. And again, with the website there too, check back to the webinars page and whenever you'd like there, and we'll have our entire history, including today's webinar up there on there shortly. On behalf of Gina, as well as the entire team here at HealthLinx, we thank you for joining us and taking time to view our presentation. Have a great day.